Hello and good afternoon, everyone. Welcome to the Brown Mamas Fireside Chat. And today I am really excited about our guest that we have. Today we have Lisa Peyton. She is the founding CEO and president of the Foundation for Black Women's Wellness in Wisconsin. Her health advocacy grew out of losing her mother to heart disease in 2006. She then launched Black Women's Wellness Day and later built the foundation into a statewide Black women's health and equity organization. Publicly, her work has centered not only on general wellness, but also on Black maternal and child health, community listening, policy change, culturally grounded work, and cross sector partnerships. She has helped elevate the Black Maternal and Child Health Alliance, supported Dane County's Saving Our Babies work, and publicly pushed for structural fixes like 12-month postpartum Medicaid coverage. What also stands out is how she talks about the problem, not as a narrow clinical issue, but as a larger ecosystem, issue shaped by racism, economic insecurity, stress, biased systems, and the need to actually listen to Black women. In her writing and quoted remarks, she consistently frames Black maternal health as both a health emergency and a leadership challenge requiring accountability, investment, in Black women led solutions. Help me in welcoming today Lisa Payton. Welcome, Lisa.
Thank you so much, Mayon. That was such a wonderful and generous introduction. I really appreciate that. Happy to be here.
Oh, and we are so honored that you are here today. I am going to dive right in because I know that everyone is excited to hear from you. And first, what I want to start with is your work in Black women's wellness,
Mhm.
and that it was shaped in part by personal loss as well as personal conviction. So, how has that journey shaped the way that you lead in this space?
It has shaped absolutely everything, and you mentioned it in my intro. I am not a health practitioner. I'm not someone with a medical background. I am a woman who has lived a life and observed the reality of health disparities in my family. And it was that very deep personal loss of my mother in 2006. Roberta Peyton was her name.
Mhm.
And her death at the age of 64 from congestive heart failure was a wake up call to me. And it sparked something that I had witnessed my entire life from girlhood, growing up in her hair salon. And all of us know the beauty and the power of a hair salon
Absolutely.
in our community, the intimacy, the sisterhood, the meaning of Black women building businesses to create generational stability and wealth, and what all of us as Black women encompass in our consciousness of what we're doing daily to grow our family legacy and to make up for gaps because of inequities and systemic racism. We are making up with our lives and our lifetime many generations of gaps on purpose. And that was my mother's life, her purpose, her journey. And unfortunately, her death prematurely from a preventable illness, I awakened to the fact that that was a trend and not an exception.
Mhm.
Her death, her funeral, everything that transpired afterwards took me back to all of the beautiful women whose hair I shampooed in her hair salon on West Broad Street in Richmond, Virginia, which is where I'm from.
Oh, okay.
Um, yes, yes, I'm from the East Coast, but
Yes.
Wisconsin is my second home. We'll talk later about how that I was led to be in this work in a state where we really need this work. But I've attended the funerals of many women with my mother and then after my mother who were in their 60s, 50s, 40s, 30s,
Mhm.
passing away from heart attack, stroke, diabetes complications, all the things that we know. We don't even have to talk about it in detail. Any Black woman in this call knows what it means to lose a mother, a aunt, a sister prematurely. That's a story that when I began this work and began talking to Black women everywhere,
Mhm.
I didn't have to translate a lot about why this work and this vision is so important. And so all of those women whose names I can quote to you right now are the reason my mother, those beautiful women who gave their all so that we might walk more freely in the world, who you see sacrificing and building community, strengthening our families. They're the foundation, literally, that went into why I named this the foundation for Black women's wellness. We have always been the foundation. These women are the foundation. As women,
Mhm.
we are the foundation of our communities. And it is that thing that powers me and everyone who has joined me in this work. Our incredible team, our board, our partners understand what's at stake because we've lived and walked the casualties, but we've also seen the power of what happens when Black women organize themselves around a
Mhm.
very explicit purpose and the incredible, unstoppable power we have to be the change that we seek in the world. And that's what the foundation and our work, whatever branch it takes, chronic illness prevention,
Mhm.
stress reduction, economic security, or Black maternal child health improvement, that is the foundation of why we exist.
It was your background and your story and the catalyst for why you do what you do that made me really excited to interview with you, because just a little taste or a little touch on my story is I too lost my mother
Mm-hmm.
early.
Yeah.
And but literally, I tell people all the time, we lost our matriarchs in a span of a year. So
Yeah.
my aunt passed away, then my grandmother, and then my mother.
Mm-hmm.
And I looked, and at a blink of an eye, they were all gone. And I'm like, these women who are the essence of who I am, just what feels like a blink of an eye, just gone.
Yeah.
And so I think about, if our healthcare system had been different, we had to educated ourselves more on advocating for our health, especially with my grandmother and my aunt. Things could have been like so different. And so I appreciate the work that you are doing, and I'm just eager to hear more about with today with the interview because of that.
And and I know you have questions, but I have to, I have to
No, let's talk about it.
endorse and express, the depth when I stand in front of women, and I make this speech over and over again for 15, well, not just 15 years, for 19 years, because the work started before the nonprofit was established, right? I know
Of
you
course.
understand a little bit.
Yeah.
We're doing it with no resources because it's important. We're doing it out of conviction because we've seen our mothers and our aunts go.
Mhm,
I just
mhm.
want to really drill down on the urgency of that we take that in when you said your mother, your aunt, your grandmother. In the span of a short period of time, I lost all three of my paternal aunts. They were
Mm.
50, 67, 62, and 52
Yeah.
from heart attacks and strokes.
Mhm.
And then your mother is gone. And then you can name at least 60 women whose hair you shampooed as a teenager, whose funerals you attended, who were, not elderly. They're not reaching old age.
Yeah.
We are the one of the generations of women, me and so many of the women in this work, not all, but so many. We say we're motherless children.
Mhm.
We know our mothers are always with us, so we're never truly motherless. And we
Right.
know that on a spiritual level, our mothers are literally with us. But
Absolutely.
on this earth, on the day to day, these matriarchs who gave all, I have to stress
Yeah.
that, who gave everything and all in every way imaginable, are
Mhm.
not here. And that's a legacy we can't ignore. And it takes so much work to prevent that. When you say it's nothing more bitter of a taste in your mouth to say, if we had only known more, if we had been present with them in every appointment, if I didn't live, 700 miles away and could go to that consult with that physician, because they're not always understanding, or they're not translating. How often it is that Black women experience different levels of attentiveness and care, different levels of urgency in diagnosing our conditions. And then there's that interpersonal dynamic between
Yeah.
caregivers who most usually don't look like us.
Mhm.
And what would have happened, if we were in a better position to understand all the dynamics that were happening, that
Right.
led to these women being gone. And so we're working against that every day, to change that, so the trajectory of all of us who have been left behind, that we surpass 64. Which is,
Yes.
we were saying 15 years ago through data that I was looking at, that 64 looked like the new life expectancy for Black women, while our white counterparts hover around 85.
Mhm.
Why is 65 the termination date for Black women? That's unacceptable. And I think it was a Black women's health imperative that was talking about this many, many years ago. And that dynamic hasn't changed, though we've made progress. And so we have to conscientiously wake up every morning as Black and brown mamas,
Yeah,
understanding that one of our explicit charges in this time is to be an advocate and an active source of change in this movement to preserve our own health and our lives.
absolutely. So beautifully said. When you think about Black maternal health, what is the personal truth you carry into that work that you wish that more people could understand?
Oh my goodness. I'm a mother of five, five children.
Okay, mother of four.
Mother of five. My children are range in age from 32 to 19. And I had, more pregnancies than I had babies, right? So I'm
Mhm.
an expert in this, as are all mothers and women who study motherhood or service mothers in other capacities, whether they birth children or not. Um, and one of the things, as a mother who had my own experiences with our maternal and child health systems and medicine, we can't wait for others to fix what's broken. Um,
Mhm.
no one's coming. That sounds cliche now. No one's coming to save Black women in this quandary of health and birth disparities. We are the answer. Now, can we bring others along in that? Absolutely, and we must, because everyone is responsible. Everyone is responsible for addressing and taking accountability and responsibility for the inequities that have caused the maternal and health crisis in our country, and particularly as it
Oh,
pertains to Black
absolutely.
women. We didn't create this. It's not our personal behaviors. It's not our
Mhm.
missteps as women not taking care of ourselves, and all of those things that personalize this. It is a systemic issue. And yet, while we hold systems accountable and do all that work, we have to understand that we have to be the leaders of this work. And it has been Black women leadership, Black women leaders, Black women's voice that has taken us to a place today where this issue is more front and center than it has ever been. But it didn't come from external concern, it came from internal determination to say this is unacceptable to us. And
Mhm.
we will take the first line, though we aren't responsible for creating it. We're responsible for saying it's unacceptable and mobilizing ourselves in an organized way to change it. Our leadership is the answer. That I know for certain. That I know for certain. There's no one
Yeah.
more qualified to speak to the issues. And it doesn't matter what your credentials are. As a woman who experiences pregnancy and birth, you're qualified to speak on this issue from that experience. And any other credentials that we have, using all of those tools that we have at our disposal to elevate this issue continuously so that it continues to be prioritized, taken seriously, that there's measurable action and change that we can see year to year. We can't let up. With each victory that we experience, however big or small, no matter how many states begin to invest more in doulas, no
Yeah.
matter how many more states, create community health worker programs to support pregnant women, no matter how many clinical community collaborations we have, it's not enough unless it's happening everywhere and unless it is absolutely fully funded in a sustainable way. And particularly in this climate, which I know we'll get to in a minute,
Yeah.
in this political and social and economic climate, we have to understand that this is a long game, and we
Mhm.
have to have the stamina to stay the course and not be worried about being experts. We just need to show up, speak from experience, build coalition, um,
Absolutely.
and do the work, however that work looks, from the positioning that we have and the access that we have to people to verbalize and to move them into deeper understanding of the issue.
Absolutely. And speaking of like the impact that has been made, could you share with us, because you've been in the Black maternal health space for so many years, where do you feel like your work has made the most meaningful impact?
Oh my goodness, I could spend a day talking about this, and I love seeing messages coming through in the chat because I see some of our staff commenting along with other guests. And hello to everyone out there. Thank you for tuning in.
Yeah.
We have done so much in the space of Wisconsin and locally in our community, while also supporting national efforts, which I can talk about later. But I saw one of our staff persons, one or two, who is a part of our maternal and child health team. We've really spent time over the last 10 years reimagining what Black maternal and child health could look like
Mm-hmm.
in our county and in the state of Wisconsin, which is a state where people don't associate with Black women or Black women's health. Many people say, "Oh, are there Black women, Black people in Wisconsin? Is there any
Yeah,
significant community of Black people in
I've heard
Wisconsin?"
that
I asked that question
many times.
before. And
Yes.
in fact, we are sitting in what I call the crucible, a very consequential place for health inequities. We happen to have some of the highest rated healthcare systems, and a higher rate of healthcare coverage for Black women than in many other states. Many
Mm-hmm.
positives that are happening here. We have incredible health and medical systems, and many of those systems are partnering with community and investing in solutions that are community led and created, and I can speak to that. But we continue to lead the nation among the top five consistently for highest rates of Black maternal mortality, infant mortality, and a crisis in the maternal and child health space.
Mm-hmm.
And that is unacceptable. So, as we see the national statistics that say that Black women in the US are 2 to 3 times more likely to die from pregnancy related causes, and we talk about why, what are the root causes. We know it's beyond medicine, it's beyond personal behavior, it's tied to income, education, and all of the systemic pieces, access to care. All of those things are of elevated urgency in Wisconsin, where we have just traditionally, over the last 35 years, that data has been collected by our state health departments, where we have been in a position where Black women are at risk of themselves, of facing very poor maternal outcomes, and our babies are low infant birth weight crisis for Black babies is amongst the highest in the nation here in our county. So it has pushed us as an organization to reimagine what could Black maternal and child health look like if we created a stronger ecosystem of of partnership, of community-led solutions, and we've got a lot of great things happening. Accountability, the advocacy, there's simultaneous work that we've done here. We've built local programming to provide more immediate resources to mothers on the ground every day who need greater access to care, who need doula support. We've built infrastructure with health systems where they are funding our ability to create a countywide doula collective that is now 4 years in the running, and we're providing. Yes, yes, and we created that solution with our health system partners at the Dane County Health Council, and even have engaged in collective, creative, collaborative fundraising to fund that as part of a major countywide initiative called the Saving Our Babies initiative. That has led to a care coordination model that we have also partnered with our health systems to create, where every Black pregnant person who goes to any of our clinical clinics or hospitals locally are screened for social determinants of health. So, beyond their medical needs, which is always critical, we're also screening every Black pregnant woman for their social economic needs around housing, food, transportation, income, employment. We've placed community health workers in clinical settings and in community settings. We have a team of 3 community health workers that existed before this work, but who are integrated into this work, who work with doulas and with clinical partners and with community based social needs organizations to coordinate care for high risk pregnant mothers who really need the full gamut of support to stabilize their health and their personal lives. And we have been co-managers of this model that we've built with health systems for the last 4 years, and beyond that 4 years of building this model in a very research-based way. So in our 8th year of doing this work together, we are seeing trends turn in the right direction in terms of gestational age, pregnancies going closer to term,
Yeah.
fewer low birth weight premature births, which we know is the number one driver of infant mortality.
Yeah.
Yes, we are seeing fewer complications, fewer C-sections necessary in the delivery room. We are seeing doctors and doulas collaborating in the clinical setting, which is very groundbreaking. You know, we've been doing that for 4 years, and we're now reading about other states that have realized that that collaboration between clinic and community is the vital answer for improving maternal care for all mothers, you know. So what we're modeling for Black women out of urgency and the high stakes life and death nature of this work is also benefiting every single pregnant person and mother in our county and our health system. Just the piece of screening pregnant people is opening
Mhm.
up more doors to meet those unseen unmet needs that may not come up in a medical appointment, but it's so essential for stabilizing and supporting the mother and her entire family. So we're very proud of that model of care, that we believe is an exemplar and you know, can be replicated in other communities across Wisconsin and in other states based on their localized needs. Um, we also, as I said, are really we have placed power and voice in the hands of Black women. What has been essential
Mhm.
in this model that we've developed, in our own programs that we've developed, like our Reach for Wellness program, which provides lactation support, mental health support and referrals, um, coaching,
Yeah.
and other pieces, you know, is
Mhm.
that we asked Black women directly, you know, before we
Thank
started
you.
work, we went to Black women.
Thank you.
It's always been a part of our model. So from our origin, you know, as I was launching this work, I talked to dozens and dozens of Black women in the community to say, you know, I've got this vision, I have this desire. I want to create this organization. I don't want to replicate what anyone is doing. I don't want to step on any toes, but here's the lane that I see of unmet need. What do Black women need here in the space of healthcare, of well-being? What would be most valuable and useful, and how can we pull that together to inform what I'm developing and pull you all into it, as we build a movement that is sustainable. That's how we began the foundation, and that's also how we engaged 8 years ago as we were mapping out a potential way of reconstructing Black maternal child health care delivery in our county with our health system partners. We did 9 months of community engagement with Black women.
Ooh.
9
I
months.
need I need for other organizations and for Black women to hear this.
Yes.
Because 9 months, which some people feel like that's unheard of, no. It's 9 months of listening to what Black women need, which is so many times the problem. They are creating systems, programs, services for us, but not even asking what we need, what we
Yeah,
believe, what we feel like we need, what's the issue, what's the problem. You're creating for us, but not asking.
and that has been, as you said, business as usual. That has been the modus operandi, and why, you know, one of my arguments when people say, "Well, why haven't we solved the problem? Why are we still experiencing this?" There's huge education that is a part of this work to educate decision makers, policymakers, funders, philanthropy, um, really helping them understand root cause and the systemic nature of this problem, and that you also cannot construct solutions that are not relevant to the community that you are aiming toward. And that's been, you know, the trend. And we
Yeah.
know what that stems from, whether it's intentional or unintentional, excluding Black women
Mhm.
from having voice and agency and input in things that directly impact their health and their lives has been the way things have been done. What's different about this work, and it was one of the foundational things that we said to our health system partners, and they had reached this conclusion too after supporting, you know, other efforts over the last 20 years that had yielded some progress, but not to the level and degree that we needed. And we agreed the first thing to do is to go ask Black women and
Yeah.
Black families. So we did 9 months of focus groups and interviews with Black women, with Black men, mothers, fathers,
Mhm.
grandmothers. We even talked to childbearing age high school students.
Yeah, yeah.
And we talked to practitioners from social service agencies who serve Black families to ask some very fundamental questions. What Black women, what Black men do you see as the major drivers of your healthcare challenges? What is
Mm,
working? What isn't working? What are the primary barriers that are impacting your health? What do you perceive to be the causal factors of the Black maternal child health crisis? And they spoke very clearly, and we crystallized all of these findings into a report that everyone on this call can access on our website. It's called the Saving Our Babies report. We named this initiative Saving Our Babies because ultimately what we're trying to do, but that starts with saving our mothers and stabilizing families. Can't skip the mothers to save the babies. That's also been a
absolutely.
problem in the solutions. We don't talk about what needs to happen to front load the stability of the person giving birth. We skip to the children, and that's an incomplete strategy. So, in that, we identified many, many factors: access to care, bias in healthcare, lack of education around resources. One of the most fundamental findings was stress being an underlying factor because of systemic inequities, because of generational cycles of economic insecurity,
Mm-hmm.
that has passed down from great grandma to
Yeah.
grandma to mama to now
Generation to
daughter,
generation.
and the stress that battling against systemic racism and inequity causes on the family system and on the mental and physical well-being of the mother carrying the baby.
Mm,
And that we cannot talk about maternal child health improvement without talking systemically about all the things that impact a mother and the family she's a part of, in the neighborhood that she's a part of, in a broader ecosystem that she is navigating. And if we don't solve the social, the economic, we're not going to solve the birth outcomes. You can't do them separately. We have to have an integrated understanding of what is causing Black women disproportionately to be
mm,
sick and stressed out. And it is medical care. There's a place for research and things that we're learning about, Black women's health and the prescriptive medicine, and all these things are helping us get to breakthroughs in understanding how disease states happen in Black women's bodies. But a significant portion of the problem is social and economic in nature. So,
and with it being, I just want to, since you're merging into that lane,
yes.
I just wanted to also have you talk a bit about today's climate, like with political, economic, and the social climate of what's happening today. What
Mhm.
are some of the concerns that you are beginning to have with what you're seeing now with our social, economic, and even the political climate in regards to Black maternal health?
Yeah, and I am gonna go back to that. You asked me a question. I don't know if I completely answered it. What have we done? I would like to say that the Foundation for Black Women's Wellness has introduced innovation and the
Mm,
capacity for real change, real sustainable models of care that have invested in community capacity, that have invested in localized perinatal workforces of doulas and community health workers, and that clinical community connection of tying those assets together and then finding, which is always a work in progress, sustainable funding streams to ensure that these models that we know work can
mhm.
be sustained over time and become a part of the standard of care, the model of care that is just integrated into how the system works.
Yes.
We've modeled how that is possible. We've not done it alone, but we've been significant players. And parallel to that, we have really built the leadership capacity of Black women as Black maternal and child health and health equity advocates. We've trained over 62 Black women across 8 counties in
Oh,
Wisconsin
my.
with the language of health equity and social innovation and change through our Well
That is
Black Woman
beautiful.
Institute. Yes, go to our website and look up Well Black Woman Institute,
Yes.
ffbww.org/WBWI. That's a foundational part of our strategy for a change is empowering those most impacted with the language, with the data, with the tools to become self-empowered advocates so that, it's not doesn't rely on Lisa and just our very talented team members,
Yes.
Ayla, Dr. Michelle, I can name names, Brandis, all of us are going to do our part, but we need this movement to drive coalition and to spark leadership in
Mhm.
and beyond our organization so that we have a critical mass of women who are positioned and capable of standing in the spaces that they can touch and pushing this movement forward. So that's been essential because what that has also helped us do is establish things like the Black Maternal and Child Health Alliance, which is an advocacy body that specifically works with and alongside us to hold systems accountable, but to also
Yeah.
inform these solutions. And these are birth workers, healthcare professionals, policymakers, influencers, decision makers, doulas. That is critical to have Black leadership guiding, informing, creating the solutions that matter most, and being a mouthpiece for women on the ground who can't necessarily show up. We represent every woman from GED to PhD.
Oh,
We're at
I
the
love
table
it.
together, and that's essential to say. From GED to PhD, we are a representative body, and just the presence of Black women leadership and voice changes how systems have to approach
Mhm.
and engage and take you seriously. And in Wisconsin, that is a breakthrough reality that we're very proud of. And that has also positioned us to pull women and other allies into coalition to
Yeah.
impact policy change. So I don't know if
Mhm.
you guys have watched the national media recently, but we were part of a statewide group of partners who individually and collectively, after many, many years of pushing, achieved 12 months postpartum Medicaid coverage in Wisconsin
Yes.
in a battle for a very long time. We personally have been deeply engaged in that work for 4 years, and to see it manifest because of collective action and effort has been important. So, to sum that up, programmatically, we are impacting and changing the ecosystem. Systemically, we are impacting solutions that are really driving new models of care that impact how care is delivered. And then advocacy in the realm of advocacy and policy, we're making headway. So it's a triple threat, I guess you can say.
Yeah, absolutely.
And that has been what has been necessary here to make movement in an area where we haven't seen much change in movement for 30 years prior to this
Mm,
particular effort.
30 years.
Yeah.
Just to hear, it's astonishing to think. So much can take place in 30 years, and just to think that there hasn't been any like real substantial movement in 30 years. It's heartbreaking as well.
No, nothing that where systems can say they invested and contributed and built on their own. There have always been localized efforts led by Black women. I can name to you the forerunners of this work who were doing it before the foundation emerged, who didn't have budgets, who didn't have, six-figure grants. They were our mamas and our aunties who developed powerful organizations that were most usually under resourced, but yet making impact one woman at a time, one neighborhood at a time. And if it were not for those efforts of those women, we would not have the legacy to have built upon. So I need to say that systemically, there has not been what systems owe community in terms of viable, sustainable, well-funded solutions, but community has always stepped up to the plate to fill in that gap, whether they were supported or not.
Absolutely beautiful. And so, thinking of your organization, if we talk about some of the other Black healthcare organizations that are doing the work right now, what are some of the pieces? I know what I think, but I just want to hear from you. What do they need to start to prioritize, do differently, and protect so that they can remain sustainable, but also so that they are being effective?
Yeah. Oh, there's so much. And these are tough questions. I just want to commend you for the tough questions. And we're confronting all those questions in real time. right now. You asked a question prior to this question, which is very connected. What are we concerned about in this current climate?
Mm-hmm.
We all know that we're living in very contentious political times.
Absolutely.
We know that political shifts as of late threaten the reproductive justice movement that Black women launched, many years ago and hailed to Loretta Ross and the beloved Billie Avery and other women who we can name dozens and dozens who
Mm-hmm.
are responsible in that fight that they launched many years ago. We're still in that fight, working to make headway and to protect all the gains that we've made. Some of those gains fragile, but nonetheless gains. There's nothing less than an all-out attack on equity-based efforts. We know that right now. So organizations like the Foundation for Black Women's Wellness is just our name by virtue of who we are and who we primarily, not exclusively serve, has become a target, for
Mm-hmm.
scrutiny with false claims of discrimination and all those things when we know that the reverse is true, that we are working to solve systemic issues and inequities that have never been addressed.
Yes.
And how that is showing up, when we read the headlines of 600,000 Black women have lost their jobs this
Mm.
year from what is happening, the purging of Black women leadership and talent in our federal agencies and beyond. That trickle down effect is real. And so to say that Black women aren't under attack or being targeted in some way would be untrue. We see the trend and we know, and not just Black women, across all communities where equity and social justice and the reforms that we need to achieve equity are under attack and funding is being
Yes.
impacted, at the same
Absolutely.
time. So not only the right to speak about this work, to own the language of this work, to give true and honest, historically accurate narratives of why these challenges exist is under threat, as well as the organizations and the communities leading this work, but the funding streams that have enabled this work to move forward in any capacity is also at risk. And so it's a very serious time and a very strategic time, a time to be very strategic
Yes.
and to build coalition and to come together across whatever differences and approaches we have and to focus on what are the strategies to sustain this work through this political tide as we work for the long haul. As I said earlier, this is a long haul
Mm-hmm.
body of work. So being mindful and vigilant is important. And I know that runs in the face of the rhetoric of rest,
Mm.
which is not
Yeah.
just rhetoric, the very true deserved rest and ease that Black women deserve. And I wish I had my
And need.
shirt today.
Yes.
But we deserve rest. We deserve to not be constantly in a state of defensiveness, of fighting battles for our lives. And it was so hard for me to conceive saying that even as my mind was formulating the thought, because we are called the Foundation for Black Women's Wellness. And we believe that rest is a human right and it's not a luxury. And we all need it, we deserve it. And yet we know, like I said before, no one's going to come do this and save us and
Yes.
push and advocate with the passion and the tenacity that we will. And so, how do we find ways to balance our advocacy with our need for rest? What are the new models of engaging in leadership and advocacy as Black women? I'm talking directly to every Black and brown woman listening because we've got to understand that it's part of our responsibility as Black women to be the change makers,
Yes.
born into that responsibility, whether we like it or not. And there's an honor in that. There's
Mm-hmm.
a beauty in that. There's a power in that. And that's always been who we are. These times that we are living in are a very particular set of circumstances, but this is a powerful part of our legacy. We know how to lead. This has been what we've done since the origins of time. And yet we know that stress kills. We know what allostatic
Mm-hmm.
load is, that wearing, that weathering that happens over the life course to Black women that's responsible for why we show up with higher levels of mortality and chronic illness and disease and why we're more stressed out and sick and tired, literally and figuratively. And yet, if we don't stand in the gap, what happens? And so I
Yeah,
put
who
this
will?
to say, as we think about this climate, as we think about what we need to do to protect the movement, that starts with how do we protect ourselves while staying in the fight? And that is a very serious question, because we do have to come up with a new way of doing it. And the answer is in how we build coalition. Because the more of us,
Yes.
the more of us who are engaged, and that goes to what do we need to do to protect or do differently? We got to
Hmm.
educate the people, the masses of our community. We are like what I call the early adapters. We're
Yeah.
understanding the issue, we're educating ourselves, we are organizing ourselves, we're creating, we're producing, we're fighting for those who are aware and not aware. But we
Hmm.
need more of our community to be aware. We have to go to every neighborhood, every church, every synagogue, every hair salon,
Yes.
every corner shop, corner store,
Everywhere. Everywhere.
everywhere,
Be omnipresent everywhere.
in ways that are sustainable. Because when we empower community, one of the reasons why we've been able to sustain this local work in Madison, Wisconsin, Dane County, which is a place that has not always been the bastion of equity, is because we have engaged community. And so it's not just the Foundation for Black Women's Wellness that is holding systems accountable, it's all the community that we involved in those focus groups, those 300 plus Black women, men, and families that we engaged in our exploratory
Mhm.
process. It's the Black Maternal and Child Health Alliance. It's our Black Black Women Institute fellows now across Wisconsin. It's all of our folks who we have enlightened, equipped with the language and the understanding of this, who now shows up with us when we put out the call. And so when we don't put out the call, who creates critical mass. And when you create critical mass in an educated public, it's
Yeah.
harder to divest in them. It's harder to say no. It's harder to continue on the path of inequity when you haven't activated. And we know that from every meaningful movement
Hmm.
that has
Hmm.
brought about change. So that's one thing: is engage and equip community, build coalition, protect mission clarity. We have to understand what we're going after and why. We have to understand root causes and be able to communicate that and connect the dots for decision makers, so that there is not this ambiguity around what is driving these outcomes, and how do we fix it, because fixing it requires many many inputs from many systems, and from many players, whether we're talking about income, education, economic development, housing policy. Why should any pregnant person be homeless, living in their car, couch surfing?
Hmm.
Why should housing be unaffordable for families who are starting out having children? Why do we have inequities in our ability to access quality early childhood and daycare when mothers need to go back to work? Why don't all states have postpartum Medicaid coverage for 1 year minimum? Why are we still fighting these battles where a woman can deliver a baby and weeks later she has no more health care? That's what we were facing in Wisconsin. So there's many levers that have to move, and
Yeah.
we have to be positioned strategically to inform and command those levers.
I like to, oftentimes they said, when we give birth, we're the only, when a woman has a C-section, it's the only, uh, what is it, operation or surgical event where you are then expected to then like get up and walk right after. Like just crazy things. So, and then just think as a Black woman, having that times all of the other inadequacies when you go to have your child. So sad that a moment in regards to Black maternal health that's supposed to be so joyous,
Yeah.
stories that I've heard from Black women, especially some of the moms who were in the Brown Mama monologues, share their maternal story of how it just the happiest day of your life turned into a nightmare because of the treatment and how you've been treated. And so I really hope those who are listening take heed, understand. Also, go to the Foundation for Black Women's Wellness website. We dropped it a few times. We're going to have it in the comment section so you can go back. We definitely want you to go back and look at all of the work that they are doing. And if it moves you to like, also look at the initiatives that are happening, as well as check out the Black Women, the Well Black Women Institute. Absolutely, because I always say it's one thing to talk about a change,
Yep.
it's another thing to be a part of the change, advocate for the change, and be the change. So those are, vastly different roles, and there's so many roles that you can play.
And it's so imperative because, we're not celebrities, right? I'm not a celebrity. You're not a celebrity. Maybe there's some celebrities on this call. We hope that there
Mhm.
are. This will reach some celebrities and that they will, in turn, invest in this work that we're all doing, right? Because that's
Mhm.
a critical piece. But when you think that Venus Williams, Beyonce,
Mhm.
Allison Felix, the track star, Michelle Obama has talked about her experiences when she was
Yeah.
giving birth. And we all know about, many of the high profile deaths, whether locally in our community. Tori Bowie,
Mhm.
the track star who so beautiful, so
Yeah.
vibrant, so healthy, who died as a result of childbirth.
Mhm.
The reality that in 2026, a Black woman can walk into a hospital to give birth to a baby and she may not walk out alive,
Mm.
or she will walk out alive 2 days after, but within the first couple of weeks or months, she may be gone
Yeah.
because of something that happened in that birthing process that, as we
Mhm.
look closer at the data, comes back to, were we listening to
Yes.
Black woman when she said something's wrong? Were we paying attention when her or her partner said, this looks like too much blood, or she's not progressing and we need you to look closer, look more closely. There's a story, and I'm not, for the sake of not getting the names right, and it's not to dishonor this important person whose name I should remember, but we had a guest on one year for our Black Maternal and Child Health Summit, the mother of a gifted
Mm.
um, PhD level, top level academician in the space of Black maternal and child health, who had a beautiful baby girl. This was her life's work to study this area, and to inform and to write on it. She was
Mhm.
at the pinnacle of her career and had all of the measures that we think will protect us: education,
Right.
income, access to better care. She died as a result of childbirth just weeks after her baby girl was born, and her
Mm.
mother, who is now an advocate in that space, a staunch one, is pushing with people like Charles Johnson, the for Care movement, who lost his wife, Kira. And I'm sure everyone on this call is familiar with Charles, who is up,
Yeah.
at the highest levels of our national government, continuing to push for legislation and joining people at our national level to push the reintroduction of the momnibus package and bill, which is a very important bill for us to get behind in our states and to push
Mhm.
our legislators to support. Um, but if that's still the reality, and I think about one of my dear friends who lives here in Wisconsin, but she's from Mississippi, and we've talked. She's one of our wellness ambassadors who join the ranks of our organizations to be lay educators and coalition builders in our community, because she, like the 500 other ambassadors, have been impacted by the things we've talked about on this call.
Mhm.
When she calls me to tell me, I've been on the phone with my family in Mississippi and another one of my friends have died in the hospital after giving birth to her baby. I mean, at least
Mm.
3 women in her own personal network have died in the same hospital in Mississippi in the last 4 years.
My goodness.
And to our knowledge, there's no investigatory action, there's no deep review that is happening. These women were healthy going into their pregnancies and they did not walk out of the hospitals alive. That's unacceptable. And if it can happen to Venus, if it could potentially happen to Venus, it could happen to any one of us. And that's why the urgency of this issue, and why I'm so happy to know that your organization exists. There's organizations like this, like ours, across the nation. But coupled with that is how we need Black and brown mamas on the ground to be informed and engaged, so that when you see these things locally and they're happening to people in your family and in your workplace, in your network, in your church, that you have the language to speak to it and to plug in to whatever resources locally or beyond can stand in a place of advocacy and support, because it is a life and death issue. But there are solutions, right, also that
Yes.
we can replicate and build on a local level. And it really requires that level of passion, engagement, commitment, and holding ourselves accountable to stand on those front lines, while also holding decision makers and systems accountable for
Mhm.
investing in what we know works.
And so, when we, in this last question I have, when we look ahead, what are some of the pieces that actually give you hope? What would real progress look like for Black mothers? What would that look like to you?
Oh my goodness. Well, on the most basic level, when we see that from the solutions that we are championing, that we're seeing significant changes in the outcomes and the data, when we can say that Black women are not 2 to 3 times more likely to die from childbirth related causes, that's obviously
Yeah.
progress. When we hear Black women speaking more positively about their healthcare interactions, that when they're going
Mhm.
into clinics, into care environments, that they are being heard, that they are being listened to, that their desires for their healthcare journey and their care plans are being integrated actively and followed to the letter, that they can access quality care, that they don't have barriers to health insurance, to basic needs, that they are experiencing less racism and bias.
Yeah.
Eliminating racism is a long haul, but that they're supporting, that they're experiencing healthcare teams that are treating them in the way that they would treat every other patient. That we're not
Mhm.
hearing
Mhm.
stories of neglect. That we're not hearing stories of outright disrespect and disregard. That we're seeing more physicians who reflect the community that they are serving, that we see more Black and brown doctors, and nurses and care providers, that we have more doulas,
Yes.
that there's funding streams and sustainable ways of ensuring that doulas are built into the perinatal workforce, that community health workers are more prolific in our community and accessible, particularly to women who are most income distressed, that we have these things in place, and that we've created this ecosystem where the likelihood of having a healthier birth and a strong outcome for mother and baby becomes the norm and
Mhm.
not the exception. That's really, really important.
Thank you so much. I want everyone to hear that becomes the norm, not the exception. I think that is very profound words for us to end with today. If we're looking to be a part of the work that you are doing, whether that be advocating, volunteering, a part of the um, Institute, the Well Black Women Institute, where can they find you?
Yes, I'm going to throw this simple address in the chat. They can find us online at ffbww.org, the Foundation for Black Women's Wellness. You can follow us on all of our social channels. We're on Facebook, Instagram, Twitter, and LinkedIn, at the FFBWW. And we really want you to reach out to us. We are largely, we have local work that is happening in our local community of Madison, Wisconsin, Dane County. We're a statewide organization as well in our reach and our influence, but we're also national in our relationships with partners like the Black Mamas Matters Alliance and other bodies. And we have a national wellness ambassador network that is covering over 26 states, 500 women who wear our garb. I don't know if you can see this is one of our t-shirts that say well Black woman.
Yes, we can see it.
Don't have to translate what that means, for you. And so there are hundreds of women walking across the United States and now, overseas wearing this because they understand the mission, they understand the vision, and they are working to build pieces of this work in their local communities and asking us for more because this
Mhm.
education, this mobilization, our mission statement, we energize, mobilize, and support Black women to transform their health and their lives. That's a universal mission. And it speaks to Black women everywhere. And there's always a place for you to plug in, whether you live in Wisconsin or not. So we really want you to reach out, learn more, get involved. And I want us to stay connected as well.
Oh,
Happy
absolutely.
to meet Brown Mamas. I don't think this is the end. I believe this is the beginning.
No, this is just the beginning. We're only scratching the surface.
Absolutely.
So, again, I thank you. And everyone, please reach out. And if you leave some comments, whether you are watching live or if you come back to watch the recording today, I thank you again, Lisa Peyton, who is the founder of the Foundation for Black Women, founder, CEO, and president
Yes.
of the Foundation for Black Women's Wellness, a exceptional organization for Black women. If you're looking for an organization that is for us, by us, this is the organization. So please, please reach out. I have dropped the URL for their website, which you can go there and find out all of the information, how you can advocate, how you can be a part, how you can just educate yourself too as well. I thank you, Lisa.
Thank
Thank
you.
you so much for being here today. Everyone else, we will see you for our next fireside chat. Have a great one.
Thank you so much.
You're welcome.